Okay. So you know that feeling when you're at the DMV, squinting at the eye chart, trying to make out that bottom row.
Yeah, we've all been there.
It's like you suddenly need X-ray vision.
Exactly.
And it seems like you're ready to ditch those glasses and contacts because you sent over this super interesting article all about LASIK.
It's a popular one.
Totally. So today, we're doing a deep dive into all things LASIK, especially for nearsightedness.
Sounds good.
We're going to cut through all the hype and give you the info you need to have a really good chat with your eye doctor.
I think what people don't realize is how often we just throw around phrases like perfect vision.
Yeah.
But we totally forget there's a ton of science behind it all.
Right.
It all comes down to how the light's actually interacting with your eye and why things get blurry if you're nearsighted.
Okay, so break it down for me. What's going on in there?
So with nearsightedness, you get blurry because the light entering your eye is focusing too early. Instead of hitting right on the retina, it's focusing in front of it.
So it's not quite hitting the target.
Yeah, exactly. It's like you're trying to hit a bullseye, but you're always landing a bit short.
Okay, I can picture that. So where do glasses and contacts fit into this whole bullseye situation?
Basically, glasses and contacts are like giving you a different set of darts, right? You know, ones that are weighted to hit the bullseye even with your current throwing style.
Okay.
They're more of a temporary fix, adjusting the path of the light so it lands correctly on the retina.
Makes sense. It's like a temporary workaround.
Exactly.
But LASIK, that's about permanently changing your throwing motion, right? Reshaping the eye itself.
Exactly. We're changing how the light hits the retina. And the cool part is how we do it.
Oh, I know. Lasers. It's so cool.
It's pretty sci-fi when you think about it.
Totally.
So with LASIK, we use lasers to reshape the cornea, which is that clear front part of your eye.
Okay, now we're talking lasers. This is where it gets really cool. So walk me through what actually happens during LASIK.
So first, the surgeon creates a thin flap in the cornea's outer layer. Like imagine lifting a really, really delicate layer.
Wait, how do they even make that flap? Is it like scalpels?
No, not at all. They can do it with an incredibly precise blade, or they can use something called a femtosecond laser.
Okay.
It's basically a super precise beam of light that creates these tiny bubbles within the cornea, and those bubbles separate the flap.
Wow. So it's bladeless LASIK. That sounds like it's straight out of Star Trek. But why even create a flap in the first place?
Because that flap gives us access to the underlying cornea, which is the part we're actually reshaping.
Oh, okay.
So they gently lift the flap and...
It's laser time.
Yeah, exactly.
This is where we zap away the blurriness.
Exactly. They use this cool laser called an excimer laser.
Okay.
And it reshapes the cornea, changing how the light bends as it enters your eye. It's super precise.
Wow.
They're sculpting your cornea at a microscopic level to make sure light focuses right on the retina.
That's incredible. So after they've reshaped the cornea, they put the flap back down. Yeah. And that's it. You wake up seeing clearly.
Pretty much. Yeah, the flap naturally sticks back in place and heals really quickly.
Wow.
But before we get into the whole recovery process, there's an important thing to remember.
Okay.
You know that eye chart at the DMV?
Yeah.
Not everyone's going to ace it and be a good candidate for LASIK.
Right. Not everyone's a good candidate for LASIK. It's not one size fits all.
Exactly.
So how do you know if you're a good candidate? What are the criteria?
You're right. It's definitely not a magic wand for every vision problem out there.
Right.
It's more like, finding the perfect pair of shoes.
Okay.
What works for one person might not work for another.
So how do I know if I'm a good fit for these, like, LASIK shoes? What are the things doctors look at?
Well, first, they're going to look at how bad your nearsightedness is.
Okay.
LASIK can usually correct vision up to Digitus 12.0 diopters.
Diopters. Okay, quick refresher for those of us who don't have the eye chart memorized. Right.
What exactly are diopters again?
So diopters basically tell you how strong your prescription needs to be.
Okay.
Someone with like negative 2.0 diopters,
Yeah.
they might have trouble reading a street sign from far away.
Okay.
But someone with negative 6.0, they could have trouble seeing clearly across a room.
Yeah.
So the higher the diopter, the stronger the correction you need.
Higher diopters, more nearsighted.
Oh, yeah.
But it's not just about the number, right?
Right.
There's got to be more to it. What else?
It's super important to have a stable prescription.
Okay.
Like we want to correct the vision you've had consistently, not just some, temporary change.
Right. We don't want to correct a temporary blip.
Exactly.
Got it. So my vision needs to be on its best behavior, nice and steady. What else?
Your cornea, that clear front part we talked about.
Yeah. That's a really important one.
Okay.
It needs to be thick enough for the procedure.
Okay. So like, what do you mean?
So remember, we're reshaping the cornea, right?
Right.
And to do that safely, we need to make sure there's enough corneal tissue. It's kind of like building a house. You need a good, solid foundation.
Okay, that makes sense.
Yeah.
So are you saying my eyes can't be too thin-skinned?
Yeah, you could say that. Corneal thickness is super important for good results.
Gotcha.
And of course, your overall eye health matters too.
Yeah, of course. Makes sense.
We want to rule out any issues that might cause complications.
So basically, make sure your eyes are in tip-top shape.
Exactly.
Okay, so speaking of things that might impact eye health, what about pregnancy? Can you get LASIK if you're pregnant?
That's a great question, and it comes up all the time. It's usually recommended to wait until after pregnancy and breastfeeding.
Is that because pregnancy hormones can mess with your vision too?
Exactly. Your hormones can fluctuate, and that can cause temporary changes in your vision. We want to make sure we're correcting your actual vision.
That makes a lot of sense.
Yeah.
Wow. So many things to think about.
Yeah.
This is why I wanted to do a deep dive on this, because it's clearly way more than laser goes zap and boom, perfect vision.
All right. It's more than that.
So let's say I get the green light. I pass all the tests. Everything looks good.
Okay.
I'm officially cleared for LASIK.
Okay.
What happens after the zap? Paint me a picture of the recovery process. So let's talk about recovery. I'll be honest, I'm kind of squeamish when it comes to eye stuff, so walk me through it. What's it like right after LASIK?
It's actually not as intense as you might think.
Okay, good.
Most people actually feel pretty good right after.
Really?
Yeah, you might have some mild discomfort,
Okay.
maybe a little scratchy, a little sensitive to light,
Okay.
but it usually goes away pretty quickly.
Okay, that is reassuring. So no eye patches or anything like that?
Not usually. You'll probably get some stylish protective goggles to wear.
Okay.
Just for the first day or so, mostly while you're sleeping, to prevent you from accidentally rubbing your eyes.
Oh, yeah, that makes sense.
And speaking of rubbing, that's a big no-no.
Okay.
You really want to avoid touching or rubbing your eyes for at least a few weeks after the procedure.
Yeah, to let the flap heal, right.
Exactly.
Yeah, I can see how accidentally messing with your eye after laser surgery would be bad. So what else is involved in recovery?
You'll get some eye drops to help with healing and prevent infection.
Okay.
Your doctor will tell you how often to use them.
Got it.
And you'll probably notice a difference in your vision right away, but it's important to give your eyes a break.
Yeah, of course.
No staring at screens for hours.
Right.
And definitely no driving until your doctor gives you the okay.
So it's all about being patient. How long does it usually take for your vision to, fully stabilize after LASIK?
It really depends, but most people are good to go within a few weeks.
Okay.
Sometimes it takes a few months.
Okay.
Everyone's a little different.
Right. Makes sense. No two eyes are the same.
Right.
So we've talked about right after, but what about, long-term risks or side effects? The article mentioned dry eyes can be a common one. What about that?
Yeah, dry eyes are definitely something to be aware of. LASIK can sometimes impact the nerves in your cornea,
Okay.
the ones that help with tear production. It's usually temporary,
Okay.
but, some people experience it longer than others. The good news is it can usually be managed with just some over-the-counter eye drops.
Okay, that makes sense. Are there any other risks, maybe less common ones, that people should know about?
So LASIK is really successful, but just like any surgery, there are some risks.
Of course.
It's really important to talk to your surgeon about all of this to understand everything.
Right.
For example, flap complications are rare, but they can happen.
Okay.
And it's possible to have undercorrection or overcorrection, which means you might need a second procedure down the line.
I see.
But again, these are just possibilities to discuss with your doctor.
So choosing a surgeon you trust is super important.
Absolutely. Do your research, go with someone who's qualified, and be realistic about your expectations.
Speaking of realistic expectations, I know cost is a big factor for people thinking about LASIK.
For sure.
We touched on it a bit before, but can you explain why there's so much variation in pricing?
Yeah, so LASIK is definitely an investment,
Right.
and the price depends on a few things.
Okay.
A more experienced surgeon might cost more.
That makes sense.
The technology used can make a difference. Remember bladeless LASIK?
Yeah.
That often costs more because it's, more advanced.
Right.
And location matters too. Big cities versus small towns.
Right. Okay.
And then you've got custom LASIK treatments, which are tailored to your eye's unique shape and all that.
Right.
Those are usually pricier, but they can be a better option for some people.
Okay. It's about finding that sweet spot for you.
Exactly.
But I think the big takeaway from this deep dive is that knowledge is power.
Couldn't agree more.
Right.
The more you know, the better equipped you are to make the best choice for your vision.
Exactly. Do your research, talk to your eye doctor, and weigh those risks and benefits. It's your vision, after all.
Exactly.
And who knows, maybe you'll be tossing those glasses aside and acing that eye chart at the DMV with flying colors.
Oh, wouldn't that be something?
That's it for today's deep dive. We hope you're feeling informed and empowered, and maybe even a little excited about clearer vision.